The journey has been intense emotionally, mentally, and physically right now, carrying this heavy mix of exhaustion and hope, and it's getting difficult to bear. Do you have any solution for this, sir?
This is the story of a large number of students today. There are students who have been preparing for 2 years, 3 years, 4 years, and the question remains what to do differently, what to do now. Entrance examination, my dear students, basically tests two things, especially medical entrance examination. How well can you memorize? How hard can you work? Many students equate the two things. If I can crack the exam, if I can get a good rank, I would be a successful person. If I cannot do so, I am a failure. No, that's a wrong impression. That's a huge blunder.
Hello, sir. To be honest, I've been in the preparation phase for two full years now, and the journey has been intense emotionally, mentally, and physically right now, and I'm carrying this heavy mix of exhaustion and hope, and it's getting difficult to bear. Do you have any solution for this, sir?
The student is saying that he has been preparing for 2 years now, and he goes on to say that he is exhausted. At the same time, he still has hope, and what to do now. Now students, this is the story of a large number of students today. There are students who have been preparing for 2 years, 3 years, 4 years, and the question remains what to do differently, what to do now, what should be the next step. Let us try to understand this question by asking some more questions. If you are struggling with this question, what to do now, or shall I prepare again or not? Before answering that question, you should ask a couple of questions to yourself. The first question would be, say you have been preparing for 2 years and you want to prepare again. First question is, what different will you do now? What is the difference that you are going to bring to your preparation now? You have to be very clear with that answer. Can you identify your mistakes in the past, and do you have a plan what to do next? This is the first question. The second question is, do you have the energy to prepare again? When you think about another year of preparation, does it make you feel good? Does it make you feel energetic? Or do you feel कि अब क्या होगा? This is the second very important question. And our answer about what is to be done next is dependent on these two questions. If you are someone who knows what mistakes have you made in the past and you feel energetic to make changes, then definitely you should continue with the preparation. This student was talking about hope. Here hope is more important. But if you are somebody who thinks that, I did whatever I could do, I do not know what different I would do this time, and the whole idea of preparation just droops your shoulders, just makes you sad, in that case it is very important to know when to quit this race. See, not all battles in life are worth fighting. The problem with the entrance examination is sometimes we get so obsessed with that process, so preoccupied with that process that we do not know when to come out of it, and that is a mistake. Entrance examination, my dear students, basically tests two things, especially medical entrance examination. How well can you memorize? How hard can you work? Now both of these are important qualities, but they are not the only qualities to become successful in life. Many students equate the two things. If I can crack the exam, if I can get a good rank, I would be a successful person. If I cannot do so, I am a failure. No, that's a wrong impression. That's a huge blunder. Only two qualities are being tested by this exam, and there are many other things which make you successful in life. So if you are not good at something, probably you are not the person who likes rote memory. You don't like ratification of things. You would not do so great in the exam. Does not mean that you would not do great in some other thing. You might become a great practitioner. You might create a great team. You might make a big company. Any of those things can happen. So please remember, not doing well in the exam is not equivalent to being a failure. There are other things that you can do, and also remember when to say no to something. So my answer to you in a nutshell is, ask yourself, do you want to prepare further? Do you know what to do differently? If the answer to both of these questions is yes, please go ahead, continue studying. If the answer is no, do not fall into the trap of what we call as sunken cost fallacy. What is sunken cost fallacy? Just because you have invested a significant amount of time in something, despite knowing that it is not going to work, you continue investing more time. Don't do that. Because you spent 2 years does not mean that you have to spend 3 years. Take the exam, whatever you get, take it, continue with your life. Go to the next stage of your life. The options that you have available as a MBBS are limited. The options that you have available after doing MD or MS in any branch, whether it's preclinical, paraclinical, whatever it is, clinical, they become more diversified. And the worst thing is to stagnate. Do not stagnate. Do something. Do anything but go to the next step. So just because I am a teacher who prepares students for NEET PG or INI-CET or FMGE, I am not going to ask you to keep taking drops. There has to be a reason for taking a drop, and there has to be a situation where we say enough is enough, I want to move forward. That is my advice. Thank you.